Hello everyone. My name is Nyambura. Welcome to Caring Hands, Mother and Child Nursing. Today we are going to discuss a topic that's dear to my heart, that's fundamental of nursing practice and skills. What is nursing process? According to American Nurses Association 2021, defined nursing process as a clinical thinking model based on systematic approach to client or patient-centered care. Nurses use this nursing process to perform clinical reasoning and also make clinical judgment when providing care to patient or client. Nursing process can also be defined as a systematic method of providing care to client or patients. And nursing process can also be defined as a systematic method of planning and also provide individualizing nursing care. As we can see, nursing care has something like systematic, individualized, that means holistic care part of it. What is the purpose of using nursing process when providing care to patient or client? It ensures that the care the nurses gives is organized, logical, and structured rather than randomized. So establish a plan to meet the identified needs, also deliver specific nursing intervention to meet the needs identified. Then during this process, the patient and families are involved in decision making about their care, also improves communication among healthcare providers by ensuring to provide common language such as assessment, nursing diagnosis, also ensures that the quality and safe care is delivered to client or patients because the care provided is evidence-based and also promote ongoing process and revision to ensure its effectiveness. What are the components of nursing process? There are 5 components, that is assessment, diagnosis, planning, implementation, and evaluation, although some institutes introduces outcome identification during the diagnosis step. We're going to discuss this further. Characteristic of nursing process is systematic and continuous care, is patient-oriented, is goal-oriented, dynamic and flexible, is continuous as we have seen, is holistic, evidence-based, guided by research, best practices, and clinical expertise. Also is problem-solving in nature, identify problems, set priorities, and find solutions. Assessment. This is a first step in delivering nursing care where the nurse uses systematic, dynamic way to collect and analyze data about their client or patient. What is the data collected? That is demographics, psychological, social culture, spiritual, economic, lifestyle, and age-related information. And there are 4 types of assessment, that in initial nursing assessment, problem-focused assessment, emergency assessment, and timely relapse reassessment. There are 2 types of data that a nurse can collect. That's the primary and secondary. Primary data is the direct source of information, that is from the client themselves. Secondary data is the data that gotten from indirect source of information such as their families, healthcare professionals, records, reports, labs, and diagnostic results. Then there are 2 types of data, that is subjective data and objective data. Subjective data is the data gotten from the client or the family where they offer important clues about their perspective of the patient or client complaint. And when writing the note is written, the patient reports maybe feeling sad, feeling pain, anxiety, itchiness. Then the objective data is anything that a nurse can observe, hear, smell, touch while doing the assessment. And then we should note that this data should be replicable, meaning another person should be able to obtain almost the same data from the same client. For example, vital signs, labs, and physical exams results. What are the methods of collecting data? One is observation, that just by observing what the patient is saying, is doing, their behavior. Then interview, This asking direct and indirect questions, and also examinations such as observing and also doing palpitations. There are stages of interview, and a nurse should ensure before they start the interview they have established rapport. And then the interview has 3 stages. That's the opening, introduction, the nurse introduce themselves, then they ask the questions, and then they make sure they thank the client or the patient at the end when they are doing the crossing. Then the data obtained by the nurse should be organized, and most of the hospital or institutes provide nurses with a nursing assessment form. Then a nurse should ensure that the data they obtain from the clients or from the records has been verified and double checked for accuracy and completeness. Then the documentation, which is a very big part, is very important and should ensure that the data collected is well recorded. Then there are 5 questions. I would like you to comment below and I'll check the answer. List the 4 sources of data a nurse can use during assessment phase. And then the second question, the difference between primary and secondary source of data. And 3, how can you as a nurse assess pain in the patient who cannot speak? And why is it important to validate data during assessment? And the 5th question is, how can culture background influence the assessment phase during the nursing process? These are the references that I used, and the next part of this study will discuss the second step, that is the nursing diagnosis. Thank you for watching and subscribe to this channel. Bye bye and thank you.